and I'm going to introduce our first speaker, a colleague of mine. Welcome, Jenni Douglas-Todd, who is the Joint Director of Equality and Inclusion at NHS England and NHS Improve. Jenni, over to you.
Good morning, Craig, and I hope you can see me. Thank you so much for the introduction, and great to be on this session with you. As you said, we're colleagues at NHS-EI. And I wanted to start by saying Chag Sameach, because it is Hanukkah, which ends in about 3 days' time. I'm really pleased to have been invited to contribute to these 2 days of discovery on our people profession into the future. So I'd like to build further on yesterday's conversation that you had with Prerna Issar, who's our, as you know, our Chief People Officer, to talk on the responsibilities of the NHS people stroke workforce equalities teams within the report. We share a solid commitment to realising this shared vision for ensuring inclusion and belonging, where our approach to setting standards and competencies aligned with regulation will bring some rigour when tackling the workforce inequity, the resolutions to which offer immense potential to build on the best of our 1.3 million people. When we get it right for each and our work within our teams, in turn, we can create more of the amazing outcomes for patients that make the NHS so incredible, as both our healthcare provider and our employer. So we must celebrate that the NHS has never been as diverse as it is today. Yet, as always, we know there's much more to come. By sharing timely intelligence, ensuring our people have always on access to relevant data, always have access to relevant data, tools and indicators of impact, and the opportunity to collaborate with knowledgeable leads to create actionable insight, we can meet the increasingly challenging needs of our diverse people now and, of course, into the future. Firstly, though, please can I stress with both personal and with my EDI hat on, how vital it is that we continue with the National Vaccination Programme and prevention guidance when invited, providing that you are able to do that. We know that much of the pressure on our system is from unvaccinated people. This is the one straightforward commitment we can make to alleviate the pressure on our workforce and therefore on each other. As of today, we've had 231,095 bookings made yesterday, of which 188,464 of those were boosters, 15,091 were first doses, and 25,188 second doses. In NHS organisations, we've currently got 5,904 inpatients diagnosed with COVID, with 816 in high dependency units or ITU, and 708 new COVID cases in trust in the last 24-hour period. So it's clear this is not something that's gone away. It's not something that we shouldn't worry about. It's very much here and present with us. And of course, we know that the issues have become more concerning over the last week or so with the Omicron variant. We currently have, we've got 4% of our beds are occupied with COVID patients, and 9% currently have 273 outbreaks in healthcare settings. We've got 392 staff members in total who have died, and we have 1.1% of our staff absent with COVID. So further stats just to show why this remains an issue for us in health. I appeal particularly with those in mind who are most vulnerable and access the National Vaccination Programme, because we all want a better year end than we had last year, and a better start to the new year. We know that for the most vulnerable, it has devastating effects from the virus. And those who have already shielded for some considerable time earlier this year and towards the end of last year, whilst managing the complexity of treatment regimens and ever-changing guidance. The progression of the pandemic remains an unknown, so it's essential that we all continue to take precautions, to look after each other, to keep up to date with the health and wellbeing services on offer. And we have many of those on offer within the health sector for our NHS workers workforce. The mental health provision for health and social care staff has been strengthened to ensure that we all have rapid access to assessment and evidence-based services across 40 mental health and wellbeing hubs across the country, which provide proactive outreach and clinical assessment and access to services and support. We know that the patient-facing mental health programme, IAPT, delivered more full courses of NHS talking therapy treatment last year than ever before, despite the pressure on services from the pandemic. Likewise, the IAPT programme figure show that mental health recovery rates for Black and Black British people exceeded the 50% recovery rate target for the first time. It's currently at 51.6%, up from 48.6% in 1920. So this shows that we are starting to make some real progress through some intractable issues that we've had for many years. And we need to carry on the efforts that we're doing to strive for more. And one of the reasons I wanted to refer to what IAPT is doing is because we know that the power of clinical conversations in recovery demonstrates how valuable, informed and professional line management conversations can also be when supporting our people to achieve their potential. And this was the crux of the sessions that we started in October for Race Ahead, which was about how can we increase conversations on race to enable the NHS to become anti-racist. And I think the IAPT example around mental health and how conversations can increase is a demonstration of why conversations are important for us, including in our workforce. Particularly for those of us living with caring responsibilities, long-term conditions or hidden disability, which is the theme of 2021's Disability History Month. And you probably know that it's been running from the 18th of November and will continue until the 18th of December. So this month is an important occasion for us to come together to acknowledge the great work being done across the system to support people both at home and in the workplace, and to encourage use of our collective voice to accurately share who we are through the staff survey and the electronic staff record, ESR. Those two simple steps alone will directly influence the culture change set out in the report: passporting, line manager and staff network capability and reasonable adjustments, as well as giving NHS people colleagues the hard data they need to innovate in planning for the coming years. Disability alone and long-term illness is still hugely underreported, looking at our ESR data and staff survey data, a situation that becomes even more concerning when we think of the co-occurring underreporting of LGBT plus status, knowledge of life stage impacts such as menopause, divorce or early careers, income pressure points, for example, starting a family and career caring responsibilities. In NHS England and Improvement, we have just 6.8% people identified as disabled on ESR. But when we do the annual staff survey, the number of people that declare on there is 18%. So clearly there's an issue for us as to why we see such significant underreporting on our ESR data. Our recently published Workforce Disability Equality Standard also shows disabled staff are 1.54 times more likely to go through formal capability processes based on performance when compared to non-disabled staff. And this is the first year this metric has been mandated. Overall, 26.3% of disabled staff had experienced some form of harassment, bullying or abuse, compared to 18.5% of non-disabled staff. These are marked differences for our people. Most of our workforce who live with disability also face other compounding challenges. At the same time as long-term health condition, many of us will be squeezed between the caring responsibilities of children and elderly relatives. And thanks to COVID, an increased community role supporting vulnerable neighbours and friends, as well as increased pressure in the workplace and increased stress in the workplace. We're committed to increasing the number of colleagues who feel safe enough to share with us who they are and what matters to them, as well as identifying and removing the barriers that prevent each of us from working at the very top of our skill sets, as well as providing appropriate support. Some of the ways the NHS has provided this support have been as a direct result of the pandemic response. So, for example, when 85% of deaf colleagues at university hospitals of Derby and Burton reported they could no longer lip read on the introduction of PPE at the outset of the pandemic, evidencing a wider national challenge, PPE developed to include transparent masks, hoods and amplifiers. Work with the Workforce Disability Equality team built on that further, with transparent hoods with exposed ears to allow all doctors to auscultate or use their modified stethoscopes, again, along with transparent masks for use in surgery. Some actions you can take to support colleagues and patients with communication needs during COVID, so they don't need to compromise their PPE, are to ensure you are standing opposite and facing the person directly. Making eye contact with the person and speaking at a steady pace and as clearly as possible also helps. Where speaking up doesn't work, you can write things down. Being audible, slow and clear is good to remember, and I hope I'm practicing that today whilst I'm talking to you. Another WDES, Workforce Disability Equality Scheme supported project, saw the Royal Orthopaedic Hospitals Seen Beyond the Stigma project populate newly busy outdoor spaces with weatherproof information on the lived experiences of disabled colleagues of the Trust. Sunflower lanyards are also helping colleagues across the NHS with hidden disability to better navigate the social pressures of increased masking, something that's become important again since the mandatory reintroduction of masks on public transport from the 30th of November. And I have to say, as somebody that regularly travels now for work, it's been a welcome change for me to go in on Tuesday and actually see everybody in my carriage wearing a mask, because up until then I was often the only person in the carriage wearing a mask. London Transport, the Underground, hadn't quite got there to 100% people using it, but I'm hoping over the next few days people really will understand why the requirement is essential if we are going to continue to protect each other. You can find out more about the WDES work that I just mentioned on the WDES News on Twitter, which is the @WDESNEWS News on Twitter, and that's the account for our WDES standard team. These innovative ideas our organisations and systems are drawing on continue to foster our people promise of being a team, systems, regions and nationally. ICSs also provide us with a unique opportunity with their core purpose of improving outcomes in population health and tackling inequalities in outcomes, experience and access, to enhance productivity and value for money and help the NHS support broader social and economic development. We have also created a dedicated NHS People, Equality, Diversity and Inclusion area for our workforce teams to use on NHS Futures, which complements the Workforce Race Equality Standard, the Workforce Race Equality Standard and the Medical Workforce Race Equality Standard data sets on the NHS EI website in the Equalities Hub. And we can provide those to you, but they're both on the Futures platform. And if you search for the National EDI team, you'll be able to pick those up. Or if you look on the NHS England site, Equality Hub, you'll be able to pick it up there. Looking forward to the future of NHS human resources and organisational development report opens with how the NHS touches all of our lives at times of basic human need, when care and compassion are what matter most. And it was really important piece of work that I was happy to work on with Clive, led by Tom Simons, and I know the focus for today. We each know of the equivalent moments in our working lives, those moments when in our people profession, we can really deliver for each other. We are the NHS's people, and I can't think of another organisation where it would be such a privilege to hold that title. From an equality and inclusion perspective, we are one team working across boundaries to unlock potential throughout the NHS. Not only does a focus on equality and inclusion, so allyship, inclusive recruitment, closing gaps on disciplinaries, opportunity and pay, building our people networks, improving data capture and insight for protected characteristics. All of those things provide opportunity for us to strengthen teams over the winter. And so it's really quite apparent and needed in the current climate. And we must ensure that we don't just see it as something additional that we think about that takes us away from what we need to do in our everyday lives of work, because they are core components of that. Knowledge of who we are, how those of us who need extra consideration are developing and performing, how well those of us with protected characteristics feel, will equip us to navigate the peaks and troughs of recovery from the pressures of COVID and the restoration of services and beyond. And I just want to emphasize here that the protected characteristics is often seen as those over there, or not belonging to me, not relevant to me, but all of us have a protected characteristic. Gender is a protected characteristic. It's not being female that is protected. It's gender that's protected. Age is a protected characteristic. So there will be nobody on this call that does not have a protected characteristic. So it's really important that we are thinking about all the things that we need to belong and how we can ensure that everybody belongs. It matters to our people that they are seen and that we observe key occasions on faith, gender, sexuality and race, such as LGBT History Month, Ramadan, International Women's Day, and Hanukkah, as I said earlier, as it allows us to transcend organisational boundaries, sharing information, connecting with each other differently and amplifying often unheard voices in celebration of who we are. It matters too that we continue to measure the impacts of powerful interventions, such as meaningful conversations, as an enabler for change. And I mentioned earlier Race Ahead. I'll say a bit more about that now. The recent conversation series that we started in October, and then it was an NHS observation of Black History Month, and we brought over 1,000 change makers together from across the NHS to accelerate our capabilities on inclusion, increase confidence and equip our people to have effective conversations about race. That single month increased colleagues' likeliness to have a conversation about race by 35%, as well as seeing regional leads make solid commitments captured on video on their role in the anti-racism NHS. The National Pride in the NHS Week back in the summer also delivered 93% positivity across social media, cementing a strong statement to our people in support of LGBT+ rights and bringing the community together in both celebration and mourning during such tough times. The video sessions from both inclusion events are still available online in the National People Directorate Equality, Diversion and Inclusion NHS Futures space. A mouthful, I know, but if you go to the Futures platform and you look for the EDI, you'll be able to pick it up there. And I would urge you not to only view them yourselves, but to consider them as a resource where there are gaps in knowledge with your teams and more widely. Excuse me. So by bringing together leading speakers on both race and LGBT issues, internal and external, and drawing on the immense knowledge held within our staff networks, we broke open issues in a way that is accessible to colleagues at all levels of experience. And they were truly groundbreaking moments for both of those. Challenging inequity means acknowledging our failings and taking on the work of change. And that can be tough to make a place for it when we're working so hard to restore services and tackle the backlog, particularly with the added challenge of being constantly in the media spotlight. But better understanding and adapting with the uniqueness of our people, so the new ways of working and delivering care pillar of the people plan will underpin sustainable delivery all the way through the limits of the pandemic and beyond. Much of our current people and workforce planning is unique in benefiting from an intense, accelerated and learning curve for us all. The most pressing crisis in global public health in living memory. We know that our NHS and all of us, its people, are at our best when we fulfill the asks of the 4 people promise pillars and the people promise itself, the commitment we make to each other, and perhaps more importantly, to ourselves. Our HR leads are trusted advisors. They are the connectors, the expert go-to for line managers that has allowed us to deliver the largest and fastest vaccination programme ever. We now have our first ever 10-year strategy, which follows the first ever people strategy for the NHS and the NHS people plan. We are currently working on the equality, diversity, and inclusion strategy that will be the golden thread enriching those operational and organisational opportunities. And we plan to issue that the EDI strategy in the first quarter of 22-23. And what we hope to do is to engage with as many of you as possible in the journey to setting up that strategy. We will go out for formal consultation, likely to be at the start of the new year, the calendar year. And so please look out for that, and it will be great for you all to participate in that, so that we develop an EDI strategy that is both ambitious but that people are committed to. We are asking systems to report in ways we've never asked for previously, and are doing the work shoulder to shoulder to improve our ability to steer organisations towards our shared vision. If we are to meet the ambition set out in the NHS long-term plan and the NHS people plan, added and urgent focus is needed on creating workplaces that attract, nurture and retain talent from all walks of life. Inequalities in any form are at odds with our NHS values. And I'm hoping that we can all say as individuals that it's at odds with our own personal values. The fair treatment of our people is directly linked to better clinical outcomes and better experience of care for patients. And whilst the diversity of the NHS workforce is increasing, it isn't reflected at the same rate within senior levels of the health service. If we are to be a model employer, particularly as the largest employer, and make the NHS the best place to work, we must be better in diversity at senior levels, increase the representation of colleagues with protected characteristics. I'd like to take this occasion to thank you for your work and to invite you once again to please join the NHS People Workforce Equalities Community of Practice on NHS Futures. We're also running session 1 of our Lunch and Learn Empower series on meaningful conversations about disability on this December the 16th during Disability History Month. So please do feel free to join us then. We have designed the session for band 6 to 8 line managers because that's the biggest cohort of line managers, but it is actually open to all. And you can sign up for it via the NHS events. So thank you again for asking me to come and speak with you today and for your time. And it's been a pleasure to contribute. Thank you, Craig.
Thank you, Jenny. So whilst we've got you for 6 more minutes, and I do know you're a bit pressed on time, there is one chat there is one question in the chat, and which is surrounding reflecting sort of on COVID-19. It's generated sort of some really amazing innovations. For you, what was the best highlight from the past 18 months that you really want to hold on to?
The best highlight, that's a really difficult one, actually, to kind of pick one. I think the first thing that comes to mind for me, and it's something that was evident whilst I was deputy chair of University Hospital Southampton, so not working in my current role, which was the ability of the NHS to transform overnight. We were facing a pandemic unlike we had ever witnessed before. Real nervousness because it was unknown what COVID-19 was and how it would impact. The fear that the NHS would become overwhelmed. And despite concerns for individual safety, all of the NHS stepped up. And I remember as Deputy Chair, us suspending our governance arrangements and putting in place something that was more agile, and witnessing my colleagues in UHS innovating, flexing, and just rapidly responding to what was required at the time, with the knowledge that we were likely to make mistakes because we were doing things at quick pace. We were asking the exec to make decisions at quick pace, but that support would be there. So I think for me, Craig, that would be the biggest thing about the ability of the NHS to transform, because up until then, we have always heard that things move really slowly in the NHS. And that was an example of how, if we are all focused on the same thing, on the same journey, that we can actually do things quickly. And so I have taken that hunger, if you like, into the work that I'm doing now as the Director of Equality and Inclusion in NHS-EI, because I think we need to be as equalities, race, LGBT, disability, gender, etc. Let's not sit around and say that it's going to take a long time, because change takes a long time. Let's grab what we witnessed through last year and into this, and take that learning into addressing what I would say has been an additional pandemic and endemic around racism and discrimination.
And looking forward, what would you say are your hopes and aspirations for looking forward to the year ahead?
I think my biggest hope is that we really, as a workforce, really take up the mantle around inclusion, around discrimination, and around diversity, and that all of us can be saying to each other, what we've got now isn't enough. What is it that we need to do? What is it that I need to do? And then how can we collectively make sure that we are creating sustainable change for the future? And that's the thing that gets me out of bed in the morning.
Exactly the same, Jenny. So Thank you very much. A really powerful and actually great run through in terms of quite a lot of content. A lot for us to kind of go away, reflect on, but when you reflect on things, there's also the importance about how do we convert those reflections into key action. And I think sort of there's some real solid takeaways for us. So thank you very much. Have a lovely day, and I shall see you anon.
Yes, see you shortly. Take care. Thank you very much again. Bye-bye.